my name is Alison Krentel, and I'm at the School of Epidemiology and Public Health here at the University of Ottawa, and I'm cross-appointed at the Berea Research Institute. So I came to the University of Ottawa in September of 2020, but prior to coming on board on faculty, I've been a social science researcher for 15 years. My research is based predominantly in neglected tropical diseases, a group of 20 diseases and conditions that affect around 1.7 billion people living in the world. So my main area of research is around neglected tropical diseases, or NTDs. There is a group of these NTDs that are addressed through what we call mass drug administration, and that's where you give donated treatments to people living in an endemic area. And they're given to people repeatedly every year for multiple years in order to eliminate or control the disease, depending on what disease you're talking about. So my main interest and focus is understanding why people take those treatments when it's offered to them, why they don't, who we're missing, so if our programs are inequitable, and also how we improve the reach of our programs. And so most of my research is focused at the community level and at the health systems level in order to improve the effectiveness and equity of those mass drug administration programs. Our research is coordinated through the Threads Lab, and we currently have active research projects in Papua New Guinea, in Indonesia, in Mali, and we just wrapped up a project, a 2-year project in Ghana and Madagascar. So NTDs, by their definition, neglected, have been neglected or overlooked by policymakers, by health systems, and by the general public as well. And what we've learned in working with the NTDs is that these are diseases that affect people living at the end of the road, people who are generally left behind by other services, by healthcare provision. And what NTDs do is they effectively perpetuate a cycle of poverty. So they are diseases that generally have greater disability or morbidity than they do mortality. And so they're diseases that we tend to overlook in lieu of diseases like HIV/AIDS, malaria, or TB, which have higher degrees of mortality. But what we've learned about the NTDs is that when we actually address them and deal with them, we can make a huge difference in a community. So when you imagine a woman who has elephantiasis due to lymphatic filariasis, not only is her economic future in doubt, but maybe she can never marry, or she is stigmatized by her community. And so many of the NTDs, we find that when we actually address them and reduce that morbidity associated or disability associated with with the condition, with the parasite, that we can actually make a huge difference in the lives of people in their households and in their communities. And there have been several studies that have looked at the increase in economic capacity when we have deworming programs and when we actually address NTDs. So when I think of an example of a project or an initiative that makes a difference in improving the way we address neglected tropical diseases, I think particularly of the project we just wrapped up in Ghana and Madagascar on female genital schistosomiasis. And this is a condition that we estimate around 56 million women and girls in sub-Saharan Africa are facing. It is caused by chronic infection with schistosomiasis, which is a parasite that's really easy to get when you come in contact with freshwater snails. And so one of the elements of this project was to help train clinicians community workers and individuals who about female genital schistosomiasis, or FGS. And what we found repeatedly as we carried out these training sessions was clinicians would say to us, nurses would say to us, I've seen this before and I didn't know what it was. And so to be able to help the health system respond to this really important disease was fantastic. We have a long way to go still to increase awareness about FGS. It's a really important disease affecting women and girls in sub-Saharan Africa. So our FAST project, what we called it, FAST package, was a step in the right direction in addressing this misunderstood and very neglected area of NTDs. I think first of all, get involved. Right now, I think one of the advantages of the pandemic is that we have a lot of online webinars and things that you can attend to learn about it. There are groups like ICORD's Community of Practice. We have a lot of early career researchers and young students who join monthly webinars that are hosted. It's a great opportunity to meet other people working in this area. So I'd say, first of all, get involved and learn. So if you're interested in knowing a little bit more about public health and global health, and you want to advance your career in that direction, it's definitely worth looking at the School of Epidemiology and Public Health here at the Faculty of Medicine at the University of Ottawa. We have dedicated courses and streams in global health for students who are interested in specializing in that area, certificate as well. And increasingly through the Internationalization and Global Health Office are opportunities for practicum placement and learning with some of our partners around the world. So CEF is a great place to look if you're thinking about a career in global health, but also if you're interested in public health in general and epidemiology, it also has wonderful programs to offer.